Hello, and thank you for joining us for today's webinar, Resiliency Strategies for Recovery in Bipolar Disorder. I'm so excited to welcome our three presenters who have been researching resilience at the University of Minnesota. Thank you so much, Anne, Carissa, and Piper for joining us.
Should we go ahead and begin? All right, perfect. Welcome. My name is Piper Meyer-Kalos. I'm a clinical psychologist. And I became interested in this idea of resiliency and what that looks like in treatment over 10 years ago. So what we've put together is, if you'll go to the agenda, I'll walk you through that, Anne. What we put together is a kind of an amalgamation to give you a snapshot of the kinds of things that we've tried and the way that we've conceptualized this to give you a picture of this. And then the last thing we're going to end with is an example of one of the strategies that we use to teach how to develop or experience more of your own positive emotions at the end of this presentation, and then we'll have some time for questions. So I'm going to give you a little bit of background, a little bit of research and some examples, and then an actual one of our positive psychology activities that we use. And if at any time you have any questions, feel free to put them in the chat. We are really happy to answer any questions that you have. When we switch presenters, we can even answer questions then if needed as well. Next slide. Okay, so I like to start at the beginning, and I like to put this picture in here because there's an assumption oftentimes when people hear the word positive psychology, they think of this yellow smiley face. And the one thing I think that couldn't be further from the truth, if you look into what do we mean by the study of and research in this area of positive psychology, is this yellow happy face seems very two-dimensional. That oftentimes people hear that word and they think, oh, that's just the study of happiness. And yes, happiness is a part of what's considered positive psychology and the study of what makes people happy and contributes to happiness, but it's certainly not what we think of as the bigger vision here. So if you'll go to the next slide, I want to expand on this a little bit because to me, this started to really sink in and help me think about what was missing from the current interventions that I was using in the space that I was working in. So when I dug in a little bit deeper, if I think about what's the definition of positive psychology, if we just kind of looked at some of the standard definitions, one definition is the study of positive emotions, positive character traits, and the enabling institution. Another one is around the scientific study of what enables people and communities to thrive. So it's this idea that how are we helping people really expand and broaden their strengths and apply them in their day-to-day lives, as well as how do we help them live more meaningful lives and be in a situation where they feel like they're thriving? What is it that contributes to that? And if we get down to that, it really starts to expand what the opportunities there are to enhance what we think of as recovery. And I'll get to that in a minute, using interventions from this positive psychology space. Next slide. So if we broaden this and think about what are we aiming for as an outcome, that's where well-being comes in. So this idea that traditionally in the field of psychology, where I come from, we're taught and we really focused on what's going wrong. What's going wrong that is not working for the individual, and what are the tools, strategies, information that we can help provide that will reduce that amount of disability or reduce the amount of symptoms that someone's experiencing. But that's a very narrow definition of what being well looks like. Right? This idea is that if we remove that distress, if we remove the experience of symptoms, are we really helping people, if we think of it in positive psychology terms, flourish? Is that what it takes to help people flourish, or are we missing something? And if you look at the field of positive psychology and think about what do we really mean by this topic of well-being, you start to imagine that there is something more to this than just removing what what isn't working well. And I want to preface this by saying, I'm not suggesting that our current state of interventions are not helpful or effective, because there's lots of research out there that suggests it is. What I'm suggesting is there a piece missing, or have we not gone far enough? Is there something more that we can do that really expands and contributes to the thriving state, rather than just removing whatever the distress is? So if we look at this, this is from the preamble in 1946, which I think is quite telling, right? Health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So that suggests that part of our role in providing treatment and helping people get better isn't just to remove what's not working well or what they feel like they might be struggling with, but to help them thrive. And so this got me interested in, are there alternatives out there in the intervention space of things that might help where there's been a deficit of what options people have access to? Next slide. So this really kind of talks about what kind of the current space of things kind of look like, especially when I first started looking into this. And so there's been, goodness, for 10 or 15 years, a huge focus on what we call evidence-based practices, particularly in what we think of as kind of talk therapy, or sometimes called psychosocial approaches, right? And these are helpful. I mean, if you look at the research, there's good research to indicate that when you do specific of these interventions, they do help with things like informed decision-making, like coping strategies, like relapse prevention, right? So preventing hospitalizations. There's good data to suggest they work. However, also, I would say in the last 15 to 20 years, we've seen the rise of this recovery movement. So if you'll go to the next slide. Yep, that one. So this idea that how are we, in the interventions we're providing, how are we contributing to this idea of recovery or not? One question that I always like to ask, I've done a lot of training, trained a lot of different clinicians, and I will often ask, do you feel like what you're providing in your treatment is recovery oriented? And I would say 99% of the time, everybody likes to say yes. What I think is really different is what you begin to ask, where does that show up in the treatment that you provide? What do you do or say or provide that suggests that this is where recovery shows up in what you're doing? This is where I think it gets kind of interesting. And there are definitely things that are built in to some of the existing evidence-based practices that show up, especially around language. I feel like language is one of the biggest places we can see recovery orientation show up. But my question is that enough? Is that really enough to really push those more positive outcomes, to push somebody into that space of thriving? Right? So if we think about what are some ways we can incorporate recovery into treatment, right? What are the options? Positive psychology starts to stand out, or at least to me, when I was exploring this for the first time, as this real option. Next slide. So how is it that it can promote this? One of the things I think that it's important to start with is, if we look at positive psychology interventions, they are aimed to increase the experience of positive emotions. That is one of the sole purposes, is that they are targeting ways that people can experience more positive emotions more often, right? So if that is the goal of these kinds of interventions, how and what ways might they promote recovery? Well, it comes down to this idea that the more times that people experience positive emotions, it opens up some more opportunities for them. Opportunities to experience more thriving, to improve their well-being, to use their strengths, to really, each time that they experience another positive emotions is another opportunity. And there's some really interesting literature on something called the broaden and build theory, which suggests that every time that somebody experiences a positive emotion, it opens up something we call the thought action repertoire. And if you think about it, when you're in that state, you can think that you're often more open to what's going on around you, to new ideas, to discovering new opportunities, new resources, new social connections. And so if there's a way that we could increase the likelihood and increase opportunities for people to experience more positive emotions, could that be a target, a way to increase recovery? And in fact, could that be a way to balance out not just remediating the weakness, okay, but building in this resiliency space? So at the same time that we're helping people with what they struggle with, we're also helping them to find more ways to find meaning, to find purpose, and to thrive. And so that is what I was really aiming for. One really good example of where we put this into practice is an intervention we call individual resiliency training. So this was part of a larger intervention that was aimed at treating early intervention for early schizophrenia. Okay, so we call it first episode psychosis. And this was the individual therapy intervention as part of that. In addition, people received more than just individual therapy in this bigger intervention we call Navigate. There was supported employment and education, there was family education, there was medication management, case management. So it was a bigger intervention. This was the individual therapy component. But as part of that, we didn't want resiliency to just be this term, right? Just not something we just named it, but that it actually had meaning in there and targets where we specifically put strategies, activities that would lead to this increased experience of positive emotions. Okay, so it was this combination. It's really quite a large intervention. It includes a lot of evidence-based strategies, right? So we pulled from existing evidence-based strategies around illness self-management, around psychoeducation, around cognitive behavior therapy. All of those are built in, okay? In addition, we built in elements of positive psychotherapy. So these are baked in as a key component in the IRT intervention. Next slide, there you go, perfect. So how does that show up, right? Shows up in three key ways I'm gonna explain. One of them is that personal goals are a priority, that it's about the person's choice, what's important to them, and how we're gonna focus and target everything related to goals. But as part of that element that happens right at the beginning of treatment, we've integrated the brief strengths test. Now you might say strengths, we all talk about strengths. Many people who've gone into treatment remember those questions that you get about strengths. How is this different? It is different. I've yet to come across, except for a very small number of clinicians that actually think about strengths this way right out of the gate. It makes sense to them when they learn this, but they don't get a lot of training in this. This isn't just somebody asking the question, what are you good at, right? It's not about what you're good at. This is about us eliciting from individuals when they come in, what kinds of character strengths stand out for them. So these are things like curiosity and love of learning and kindness and gratitude and zest. These are really what I consider to be true character strengths that are very meaningful, that come out for people. And we've integrated that into the goal setting process right away when you're getting to know someone and build that therapeutic relationship. It's initially part of that process. So we want to individualize it related to goals. We want to build on that individual process and have it come out through strengths in particular. So talking about yourself in that strengths, rather than just having to talk about the things that you might be struggling with. Okay. In addition, we incorporated the bulk of the positive psychotherapy intervention. So these are these activities that are designed to increase positive emotions. So it wasn't just in name only that we said resiliency. We actually put these in here as targets that people could use and practice and integrate into their day-to-day lives in order to increase those experiences of positive emotions. And so as part of that, after it was over, next slide. As part of that, after it was over, we did, which I think is a pretty difficult task. We tried to understand, what did IRT itself, outside of the other interventions, what did it contribute to outcomes? Is there a significant component that if you got a certain dose of IRT, that it contributed to better outcomes in any specific areas? And this is what we found. What we found is people who got 4 or more sessions of that assessment and goal setting module that I was telling you about. So right where you're developing your individualized goals and you're completing the brief strengths test. So you're tapping into what your top 5 strengths are. Right? So if you got 4 or more sessions, right, then it resulted in people who had greater amounts of motivation in particular. Okay, that's where it really showed up, was in the motivation space of things. So it suggests that if people are participating in these kinds of activities, it's a way to tap into something that's really key when it comes to engagement and treatment, is what we kind of suspect. And that was one of the bigger, I would say, signals that we got out of what's specific from IRT. All right, I believe Anne is going to take over next. Yep.
Yeah. So, and I'm not sure if we want to stop for questions here, or we should just keep going. It's totally up to you.
Let's keep going and we'll answer all the questions at the end.
Okay, because I might be getting to some of the questions that are coming up. I haven't had a chance to look at them yet. So I'm Anne. And so one of the things that I wanted to talk about is that we're at a stage in research on resilience where we're trying to look at how this might look in different populations, right? So Piper was just talking about individual resiliency training in individuals that were experiencing early schizophrenia. And I looked at the literature out there on what resilience looks like for individuals who are experiencing bipolar disorder, which is the Bipolar Foundation is why we're here today. So, and one of the things that's one of the very big things that's different is that there's this change in mood, right, involved in bipolar disorder. And so because there's that greater vulnerability to changes in mood, we might want to think about resilience a little differently, right? So how can we individualize this? And so I just wanted to provide the definition there of resilience again, and just serve as a reminder that resilience isn't a trait you either have or don't have. It is a process. And so it's not just something internal, right? It's how an individual positively adapts to experiences of adversity. And so it's something that can go on. It's something that can take years. And there's a lot of variation in how we look at resilience. And so one of the ways Piper was just talking about is the positive emotions. And we know that definitely plays a role in resilience. And so 2 ways that resilience can be thought about in bipolar disorder, when I looked at the literature, is that it can be developed by increasing an individual's awareness of their mood, right? So if we know that bipolar disorder involves changes in mood, fluctuations in mood, learning about those changes, like when they're first coming on, can help to have that positive adaptation, right, to those adversity of the changes in mood. The other thing is developing those skills to cope with and address those mood changes. So some of the skills we're going to hopefully get to today could hopefully potentially help with coping with those mood changes, right? So there were some strategies that I found that are not helpful when we think about bipolar disorder, and what they appear to represent is kind of these ends of a continuum. And so because bipolar disorder often involves like kind of depression and mania, what we kind of think of these opposites, there's kind of this rush to kind of quell those opposites. And so dampening was one way that sometimes people responded to their changes in mood, is so kind of like suppressing those really positive emotions. And you would think, oh, okay, we're getting rid of the symptom, right? We're getting rid of the mania. So maybe that will help people feel better. But what the research shows is that actually it's negatively associated with quality of life and more likely to be associated with depression. So just kind of getting rid of those positive emotions actually doesn't appear to help. The opposite is kind of that holding on to the positive emotions, right? So kind of running away from the depression and kind of holding on to the positive feelings and ruminating on those positive emotions. That also doesn't necessarily appear to help. So that actually is associated with worsened symptoms and not really help with overall recovery. So I have that picture there of the stones being there carefully balanced. And so I think positive psychology has some things to say about what resilience can look like in bipolar disorder, so that we're not kind of going to either side of a continuum here, because there's that assumption that there can be an assumption that's like, oh, all positive emotions are a sign of mania, right? So we don't want to positive emotions. We don't want to hold too tightly on those, right? So positive psychology says, well, what about meaningful social connection, right? Or peacefulness, or, kind of grounding in social relationships. So not necessarily the striving to hold on, like in that positive rumination, but kind of the acceptance of the current experience, the noticing of the current experience, and then developing those social relationships to help ground you. So engagement in social roles, such as engaging in vocation, so whether that would be work or volunteer, but finding meaning in what you're doing can help with recovery. And then lastly, social connection too was another thing that I found in the literature that was very helpful. So investing in relationships that are meaningful to you, building those connections and investing in those can also help with recovery and resilience. So I'm going to actually send it back to Piper to talk about positive psychology interventions.
So now I'm going to get really specific and say, so what does this look like when we actually put it into action? What kinds of intervention tools, manuals, and approaches have been developed to support this in treatment? And we're going to give you a couple of different examples of what this looks like, actually a couple in our space that we've been working in early schizophrenia, and Anne's going to talk about one of these in the space of bipolar disorder. Next slide. There we go. So the one that I'm going to focus on is it's an adaptation from something called positive psychotherapy. And this comes from who we consider to be kind of the godfather of positive psychology, who is Martin Seligman. And originally, when this intervention was done, it was a group intervention, and it was aimed at reducing mild to moderate depression. Now, I have to preface this here. It's an interesting kind of way that this is rolled out. So originally, when kind of positive psychology approaches were put out there, it was put out to the general population and was not used very much in clinical populations. So there was questions out there about if we're applying this to people in the general population, how much evidence do we have? Or even theories to support the fact that this could be effective in a clinical population. So the study that's referenced here was kind of monumental because it was one of the very first to apply these positive psychology approaches to a clinical population. And essentially it goes like this. This is what their theory is that, go back, there you go, that building positive resources, right? So those increased positive emotion experiences counteract the negative symptoms in depression and buffer against the recurrence of these symptoms. So again, specifically targeting that mild to moderate depression. And this idea is that, and I think of it as I've got this tank, and each time I experience a positive emotion, I have an opportunity to put some additional resources in my tank. Sometimes these are additional kind of social connections I may not have had before. Sometimes these are tools or things that I found to be helpful in my life. I noticed that somebody in the Q&A was mentioning laughter, and this would be an example of something like that. It's a new tool. I was open to this. I had a good experience, and it went into my tank. So every time is an opportunity to put more in my tank. And if you think about buffering as the reoccurrence of this, think about it this way, that even now that you've got your tank full, if you do have some reoccurrence of these kinds of experiences, that now you have tools you didn't have before. That's what it's available to you, even when it comes back. And it was based on Martin Seligman's original 3-factor model, which talked about this idea of the study of happiness around the pleasant life, the engaged life, and the meaningful life, right? This idea around our strengths, around our relationships, around meaning and purpose. That model's now been expanded to 5 different areas, but you can see where that we're talking about more than just this experience of happiness. It's deeper than that. It's much more 3D than that. It's not so flat or two-sided. Next slide. So here's what I did. What I did was I took the original positive psychotherapy intervention, and when I looked at it, my read was, we can do this. Why shouldn't we be applying this to a more intensive clinical population? And in fact, aren't we missing something? The fact that we aren't applying these approaches and presenting more of these opportunities. And the big thing is, might this be a pathway to that idea of recovery, right? Might this be another tool or opportunity to increase recovery? So I took that intervention and said, yes, we can do this, but we probably need to adapt this a little bit. So what I did was the version I got, they had a couple of new, or they had one new activity in there, and that's the positive service activity. Excuse me. So we added that in. And then what I knew about goals and the importance of working on goals, we added a positive goal in there. We didn't put a lot of restrictions on it. And the other thing, to enhance the learning and the experience of positive emotions, we added a mindfulness minute that happened at the beginning and the end of every session. In some ways, this is a way to help people center when they came in, to help them focus, to bring some calm or some peace to this, but it also was this repeated practice of savoring. So it was this really kind of in the moment, in the session, practice that happened every week, twice a week, as part of being in the group that we knew that we were providing. So it actually served a number of different purposes. It was not part of the original group, but for us, we actually found it was one of the most meaningful pieces of the group to have this additional practice of mindfulness. And so it ended up that it was a 10-week group, and it actually met for an hour and a half each week, which was also unusual because groups tend to last not more than an hour. And there was a question, can we get people to stay? Will they really want to stay for an hour and a half? And I co-facilitated some of these groups, and I'm here to tell you that there was never a problem about people staying for an hour and a half. This was a group where they were not asked to talk anything about their illness, right? So there was not anything that was adapted in the materials that said, tell me a little bit about your symptoms. Tell me a little bit about your experience. It was really focused on teaching each week and then following up the following week on practicing these positive psychology activities, right? The other thing that we added that I knew based on this clinical population was the importance of practice, the importance of following up on things. So we added a booster session in. We said, come back, and I think it was like 6 weeks later, and let's see, how are things going? Are you using these things in your day-to-day life? What's working? What's not? could we practice a couple of things just as a refresher to help you keep it going? Because we didn't want them, people who were trying this out to use it once just during that 10 weeks of the group. We wanted it to be able to continue and integrate into their routine. Next slide. This is what the format of the session typically looked like. There was that informal check-in, right, where we checked in and said, how is everybody doing? How was your week, kind of stuff. We spent 5 to 10 minutes doing the mindfulness minute. Sometimes it took a little bit more to set it up. We would not just ask them to set a positive goal. We would take 10 to 15 minutes and ask people how they're doing on that. What progress have they made? What are they going to work on over the next week? Problem solve any sort of challenges. We would follow up with that home practice, whatever we had asked them to practice the week before, we would follow up with it. Now that was an interesting one, because every activity, and you'll see this at the end when Carissa walks you through the gratitude visit, every activity, it isn't just about doing it, right? There's always a follow-up. There's always a little bit about what did you learn? What was helpful about this? And maybe one of the most important questions, what would this look like if you were to integrate this into your regular routine? Maybe you do this every day. Maybe you do it a couple of times a week. What would that look like? How would that fit for you? What would that add to your daily routine? How would that help you in your aim to stay healthy? Those were the kinds of things that we talked about in that home practice check-in. And you can see why it's a critical piece of the format of the session. That was followed of what's the new skill that we're teaching. So literally every week was a new skill that they learned. And it wasn't just try this out. It was here's what it is. Here's why we think it's important, right? So we provided that rationale. Here are the steps of the skill. We would often really break it down into even smaller components than was in the original group, right? So that people could follow it and had some knowledge about it. And to the degree that we could, we would either set it up for them so they'd be ready to go, or if possible, we'd actually practice it in session together, so that when people would leave the group, they would already have some working knowledge and feel comfortable with what we're asking them to practice. And then that was followed by another practice of the same mindfulness minute. So people were getting exposed to a lot of things. You can see here's the list. You say there. These are the list of the different activities that we did in the original positive living study. And this is actually what we included in individual resiliency training. It was based on these activities. So these are the ones that are incorporated into there, right? And so it includes really simple things like using your strengths, right? So once they learned those strengths, how could they use them in a new way, to finding the good things in the day. So at the end of the day, writing down what were the good things that happened to you, to savoring, which is kind of getting the most out and kind of lengthening the experience of something positive that you enjoy, often related to the senses, right? To sometimes things that are more involved and take more effort, more motivation to do. Things like positive service, right? Going out in your community and finding some way to give back. That's certainly a bit more on the involved side. So it was a range of different things, and it really spoke to different people at different times of their life. Sometimes they wanted things that were more involved, and sometimes they were looking for simple things that they could incorporate. So it was a range of these kinds of different things that people got exposed to. The last thing I want to say is, as part of this, the group was facilitated by two co-facilitators that did this group. We tried to make it a group of anywhere around 8 to 10 people. So there was a lot to manage, but it was a requirement of the group that not only did we ask everybody in the group to participate and try these activities out, but the facilitators tried them out with them. So I want to normalize here that these are exercises and activities that aren't just for people with a major mental illness. These were actually developed for the general population, and we think everybody can benefit from them. Everybody has something to contribute to the experience of these, what these are like, how they're helpful, how they can contribute just to the daily human experience of things. And so it really normalized the experience of the group and what was going on, that everybody did them. Everybody came back, and everybody had different experiences with these. Sometimes they did them religiously. Sometimes they forgot. We get busy, things happen, life happens. And so it was a way to kind of normalize a lot of that. And as I mentioned before, not once did we require anyone in the group to talk about their symptoms, their illness, the experience of their illness. They absolutely could if they wanted to. We supported that and encouraged when people wanted to do that. We were open to hearing that, but it was not a requirement. So I think that's really important. Anne's going to talk about the results in a minute, but I think if you think about this and how different this is from traditional evidence-based practices, I think it's unusual. And I think it gives people something different to think about in regards to treatment. And I think that Anne's going to take the next slide.
Yeah, I am. Yep.
Perfect.
Yeah. And so if we remember, so the goal wasn't necessarily to reduce symptoms, but there was some reduction in symptoms, and there wasn't a control group. So we're looking here at what people, they did an assessment at the beginning, before treatment, and then after. And overall, people reported better well-being, more hope, more self-esteem, and there was some reduction of symptoms. My next slide kind of shows, if you're into bar charts, a little bit about that. So they did do a brief symptom inventory, and they did notice that did decrease, but that wasn't the goal. And even without talking about symptoms, right, there was some reduction, which was a wonderful outcome. So this positive living intervention was adapted. Piper and Carissa adapted it for caregivers of individuals living with serious mental illness or early schizophrenia. And this started in the fall of 2020. So you did it all on Zoom. And again, this was facilitated by two facilitators. One was a peer family specialist. So she herself is the mother of someone who experiences schizophrenia, and the other one was a clinical social worker. And they facilitated these 10 sessions all on Zoom, and they mirrored those positive living interventions that we just talked about for individuals experiencing schizophrenia. So a very similar format. What we learned, so this was a pilot project, what we learned is that we needed to adapt for caregivers, right? So one of the things we learned is that the acts of kindness intervention or skill set, the caregivers really said, you know what, we do acts of kindness all day. We're always kind of doing that. So we started to think about this more as like acts of self-compassion or acts of kindness towards self. And that was experienced more positively. And so that's just an example of how this has to be adapted. So when we think about looking at positive living for individuals with bipolar disorder, there is someone who's done that pretty recently. I found a study, and what they did is they came up with 4 weeks of intervention, so not 10. And this was actually all done for individuals that had just had an inpatient hospitalization. It was for individuals that had bipolar depression. So I'm guessing that was bipolar 2. They called it bipolar depression in the paper, but this was, I'm guessing, bipolar 2. And they had these 4 weeks. And they did a gratitude letter, which was comparable to the gratitude visit that Chris is going to talk about, the personal strengths, which we've talked about a couple times, performing acts of kindness, and then imagining a best possible self. And this is comparable in an adaptation to the life summary. So that's something that the positive living intervention for caregivers did, the idea of kind of like looking back at all of the things that have happened in your life, but this is kind of looking out into the future. So this was adapted for individuals with bipolar disorder. And so what they found with this is that at 8 weeks, so following this 4-week intervention, people who engaged in those 4 interventions had reductions in hopelessness and reductions in depression. So again, because we're not just talking about decreasing symptoms or getting rid of symptoms, but this idea that there was increased gratitude, increased positive emotions, increases in optimism as a result of engaging in those interventions. And so I'm going to have Carissa now talk about an example of one of these strategies called the gratitude visit.
Thank you, Anne. So first of all, thank you all. I'm super happy to be here today. So you've heard my colleagues talk about kind of resilience from the 10,000 foot view, right? And this idea that it's something that can be cultivated. It's something that everyone has access to and everybody can work towards cultivating. And we've talked about various research that explores some of the specific ways that this can be done in various populations. And we know that everyone can benefit from many of the strategies. And so I'm going to take a little time now to sort of walk you all through one of the specific strategies. And we've chosen to share the gratitude visit specifically because you can think of it as a way to get a really powerful and potent big dose of the benefits that incorporating gratitude into your life can provide and how that translates into increasing your resilience when things come up and when you're experiencing adversity. So some of the benefits that we found of gratitude in general, right, is improvements in your mood, greater enjoyment from activities, feeling more positive about your relationships. And so part of the purpose of the gratitude visit is to give you a really big dose of that, and then also to help you think about ways that you can incorporate that in smaller ways into your daily living. So the way the gratitude visit works is that you are asked to think of someone who has done something for you, been particularly kind to you, or for whom you're grateful to, but have never properly thanked. And you want to think of a person that you ideally have the ability to have a face-to-face meeting with. And the task is to write a letter to this individual, deliver it in person by reading it out loud to them, and to talk about what that person did for you, how much it meant, how it affected your life, and like the way in which you remember their efforts. And you can go to the next slide if you like. And so the participant should spend time thinking about this letter, spend time thinking about who they might want to write this letter to. Ideally, they read the letter aloud. We've found that individuals who go through the process of the letter writing experience benefit from it, but that the greatest benefit happens when you actually go through the process of reading it aloud to the person for whom you've written it. And that oftentimes this can be a really life-changing experience. And it definitely generates thoughts around how can you infuse this into your daily life? Because obviously you can't write a gratitude letter every day to everyone, right? But you can learn to appreciate those relationships and those moments in your day-to-day. And then the follow-up piece that is a major component of it is to consider how you felt as you wrote the letter, how the other person reacted to your expression of gratitude, how you were affected by their reaction, what you got out of the experience, what you felt were the most important aspects of the experience, and how it felt to express gratitude, and then how you might use gratitude in your daily life. And now it's time for questions.
Awesome. Thank you guys so much for such an awesome presentation. That was so uplifting, and I can't wait for all of us to practice these techniques and implement resiliency in our own recovery journeys. So now we'll ask some questions from the audience. So if you have any questions, feel free to leave them in the Q&A. But to start, I will find one. So the first one was, why is the vocalization and reading that gratitude visit aloud so much more beneficial and uplifting to resiliency in the long term?
Yeah, I think there's a couple of things. I think that you get a boost if we think of positive emotions when you write it, because you have to think about the good things that have happened. So we think of savoring as having a past, a present, and a future. And when you're writing the letter, you're actually savoring from the past. The act of reading the letter isn't not only an act of kind of savoring in the present, because you're really lengthening out, you can think of that experience of expressing something positive to another person and building off of their reaction, but it's also the act of really sharing what you find, that you're grateful for with that person and sharing that experience together. So I think it's kind of like it brings together a lot of different things. And interesting, the study that Carissa was talking about, when they piloted this out just in the general population, they actually found the biggest results for people who came in feeling the worst that day. So the people who felt the worst, not only did they benefit just by doing the letter, but they actually had the biggest gains in their mood that day when they read the letter out loud to the person. So there's something going on by not only kind of savoring that you do when you write it, but also building on that and then developing that shared experience, I think.
Definitely.
And I would just add that, going back to one of the studies that Anne talked about earlier on, that we know that there's huge benefit in social connection and sense of belonging, right? And so it's a pretty easy step to say that the act of sharing the letter, that part of the benefit that you're getting is that there's this sense of belonging, this sense of shared connection that is equally important.
Definitely. And then that kind of leads me to my next question. So you mentioned how you changed these interventions for caregivers and looked at that as well. Is there any benefit to caregivers participating and doing these interactions with their child with bipolar disorder, or how would that look like?
I mean, we've not piloted that specifically necessarily, but we know that, Piper had mentioned earlier that oftentimes when we run these groups, whether it's with caregivers or persons with lived experience, that the providers, the facilitators will do these strategies and skills along with the group members. And we also, from a more, 10,000 foot view, we know that everybody benefits from these strategies. So I would posit that if you had individuals and their caregivers doing these tasks and these strategies together, that it would have a positive impact. Certainly it would bring them together. It would build further connection, understanding. I honestly can't see a reason why it wouldn't be beneficial to have.
Yeah, I'm thinking too of that idea of like that shared humanity, right?
Yeah.
That we're in this together and that we are humans and we're going to benefit from this. And it's not about being identified with an illness or kind of making that the focus, but that we're learning these skills to better both of ourselves and both of our lives. And I think there could be something really powerful about that. But again, we haven't tested it. So good point to make, Carissa.
Absolutely. I think that would be a great one next step forward, but I think that you guys are so right. I think it will be a great way to, it can be great for every individual. You guys spoke a lot about the mindfulness minute. How would this look in an individual's practice in their daily life outside of the intervention experience? How can they incorporate it into their daily practice?
I mean, I would say anywhere that it fits.
Mm-hmm.
I mean, that could be really unique and individual to each person, but it's something that you could do first thing in the morning. It's something you could do before you go to bed. It's something that you could do when you're transitioning from one thing to another. I know for me, major transitions in my day are often more difficult or fraught. And so taking a minute between shifting from one task to the next to do a mindfulness exercise. But I think it could be, highly individualized.
Definitely. Awesome. So one of our guests was speaking about how she has used laughter as a stress buster and positive emotion. Have you guys done any research on how laughter can improve positive psychology or resiliency?
We have not looked specifically at laughter. I mean, I think it certainly has all of the positive benefits and the possibilities. It's just not been something that we've looked more specifically about.
Definitely. We all know the power of laughter, though. It's
exactly.
And I think there is a body of research that we have not been a part of that supports that as well, certainly.
Definitely. And then, so we spoke about the positive benefits of social interaction and connection. If someone experiences negative social experiences like bullying or stigma, how can positive psychology play a role in promoting resiliency and getting over those emotions?
So I can give you one interesting kind of concrete example of how you could think about this. It doesn't mean it's the only way, but one of the things that we teach early on is this idea of recognizing what your top 5 character strengths are. And one of the ways that we help people practice this is to say, what does applying your strengths look like in your day-to-day life? How does it show up? Where do you tend to use your strengths? And what would it look like if you tried your strengths in areas you typically don't apply them to? So the using your strengths activity is actually after you do the strengths test to identify your top 5 strengths, is saying each day for every day for a week, you use them in you use one of your strengths in a new way. Right? So not the way we typically do, right? How does our gratitude show up, or how does our kindness show up? Not something you do every day, but really stepping out of your comfort zone and applying it in a new way that you hadn't thought of before. And part of the reason we do that is at the end of the week, we talk about what did people learn when they were using their strengths in a new way? What kinds of implications might that have if you think about how your strengths could work for you as a tool? And it's really nice when we do it in individual resiliency training, because then we get to talk about, might it be helpful to consider your strengths when we come up with a step that you're working on towards your goal? Might we consider one or more of your strengths when we're talking about identifying a coping strategy? Might this be a helpful tool or something we can integrate into your relapse prevention plan? There are ways that we can really get more out of the strengths that we already have and really capitalize them. So if somebody is experiencing something that's really detrimental, like bullying, right, that really causes a lot of stress and distress, might there be a way that they can tap into one or more of their strengths to counteract that? It's not necessarily something to address the bullying piece of it. It's how they respond to the bullying. And might there be a different way for them to respond that's more protective, rather than letting it kind of build up with that constant barrage of stress and distress?
Yeah, I think that's a great way of looking at it, and a great way of applying these interventions in such a positive way. On a different note, what was the average age of the participants, and did you see any differences of success of the exercises based on whether it was like a younger adolescent or younger adult versus an older adult with serious mental illness?
So we've done the positive living intervention in a mixed group. So people who've had multiple episodes of schizophrenia and a couple of early episodes. The individual resiliency training has mainly been done in people with early psychosis. And obviously the caregivers, as you can imagine, are a little bit on the older side of things. So we have a lot of differences. Now, Anne and Carissa have observed a lot of those caregiver sessions. So I'm going to let them speak to what they've noticed. What I've noticed when I've looked at the data is it seems to be that there's not like one size fits all here. It's not like that the young people tend to lean towards things that are in this space versus this space. Excuse me, it really depends on what works for the best for that person and what they can more actively incorporate into their routines. I will say that what I've seen, at least on the individual side of things, is that some of the easier to incorporate activities like savoring, for example, it's not a big lift to think about, I'm going to try to savor 1 or 2 things every day. Really making a point. That doesn't feel as hard to really incorporate and change your routine as something else that you might be incorporating that's something new. And I tend to find that works a little better for individuals, particularly the younger folks. Doesn't mean that's a one size fits all. That's just anecdotally one of the things I've picked up. And I'm curious, Anne and Carissa, you guys have observed a lot more of the caregivers. Is there anything that stands out to you, either of you?
I would say it's pretty similar. I mean, I think we know that that implementing change in your routine is always easier if it's small things that don't take a lot of time or require a lot of burden, right? And so I think that bears out across the age groups. I think that's sort of always true. I know that with caregivers, certainly they're often really carrying a lot. Their time is very valuable to them. And so activities that they can infuse into their day-to-day practice without having to really shift gears are ones that they seem happier about and it seems more natural to them to integrate those things. And like we had mentioned earlier, recognizing that we needed to adapt some of the strategies to make them more accessible to caregivers, with, in terms of framing acts of kindness as more about self-care, which clearly, hindsight makes a ton of sense. But I will say that my experience with working with caregivers is that they really want to apply themselves to this and they really want to get the most out of it. And so their effort and exuberance, like, as they meet these tasks has been really great to see. But yeah, again, like the easier something is to put into your day-to-day practice, the more likely you are to do it.
Definitely. So for our final question, one of our attendees asked if there were any interventions that speak specifically to supporting people and helping them create self-awareness of their mental illness or their actions, and how to effectively create a bridge of self-awareness around having mental health issues.
We saved the hard one for last. I wish I had a really good, concise answer to this, but I want to speak to, that was not our intention. Our intention was really to help people experience a more full recovery. Now, interestingly enough, I do think the value is by experiencing a more full of recovery, maybe it makes you open to this idea that it's okay to explore that self-awareness, right? And what the person determines is awareness looks different for everybody. So I don't want to presume that I know what that's like or what that's about. What I might suggest is that by offering these opportunities to experience a more fuller recovery, a more meaningful recovery, a more concrete recovery, are we opening up more opportunities to make it safe to explore these things in themselves and come up with what they mean, and what's important to them in their life? That would be the best. I mean, it's a hard question. It's a hard question. So that's the best I got.
Go ahead, Anne, and then I'll say something.
Okay, I was just going to add that I think, Piper, you had mentioned at one point too, is that these are not meant to replace all the other interventions that someone might need to have maintain their stability. And so it's considered an additive, right, treatment. And so if someone's on medications or if someone's receiving individual therapy, this isn't like meant to take the place of that and be the be all end all for everyone. And so I just wanted to add that piece. So.
And I would just say that one of the other components that we talked about that is present within IRT, a really big component of IRT is the psychoeducation component, which really is about helping individuals build an awareness of what's happening for them, and what that might mean, and having an awareness of, you know, if in our case, it's often, you know, a schizophrenia spectrum disorder or mood disorder. And we know, I mean, research is very clear that the psychoeducation component is a very important component, and that having that awareness also increases resiliency, right? Knowledge is power. So that is definitely a piece of the puzzle.
Definitely. Well, that wraps up all our questions for today. Just to echo our comments from the audience, thank you all for such an excellent presentation that was so organized, clear, and applicable. One of our attendees said that she's optimistic about the activities you presented today and feel that they can help her grow her happiness and resiliency in her recovery. So thank you to everyone for joining us, and we hope these resiliency strategies can be supportive and beneficial to you, your recovery journey, and your family. If people are looking for more information about you guys, can they find you anywhere specifically?
If they want more information, they can certainly go to the University of Minnesota website, because we're all on there in different ways.
Awesome. And this recording will be on YouTube. So if you enjoyed our webinar today, please let us know your thoughts in the comments on there, and make sure to check out our other videos so you don't miss any in the future. Thank you, everyone, and we'll see you at the next one.
Thank you.
Thank you.